Alors bonjour tout le monde.
So hello everyone, and thank you for being present for this press conference for the overview of the situation in Montreal. I will explain to you how the press conference will take place. We are going to start by a speech from the Regional Director of Public Health of Montreal, Dr. Mylène Drouin. We are going to ask 98.5, please, to close down their microphone. Dr. Mylène Drouin will be starting, followed by the Mayor of Montreal, Valérie Plante, and then the Director of the SPVM, the Montreal Police Service, Mr. Sylvain Caron. Following the speeches, there will be a question period. We will ask journalists who wish to ask questions remotely to let us know that they are there through the email address that was provided. And please, we're asking all journalists to put all their phones on mute to avoid any sound feedback. This press conference is also being broadcast on Facebook Live on Santé Montréal. Dr. Drouin.
Rappel aux journalistes, s'il vous plaît, téléphone sur muet. Merci.
Bonjour à tous.
So hello everyone.
Poser des questions à distance, de nous faire parvenir leur présence via l'adresse courriel.
On ferme le téléphone.
On le ferme?
On le ferme.
Merci. Bonjour à tous.
So hello everyone. Thank you, Madam Mayor and Mr. Caron, for being here with me today. Today, we wish to have an overview of the situation in the city of Montreal and present to you the additional measures which will be implemented specifically for the Montreal agglomeration to face the community transmission that we can see and which is sustained within Montreal. So as of yesterday at 9 p.m., Montreal had 1,361 cases. That's 146 new cases in the past 24 hours. 93 people are being hospitalized, 13 of them in intensive care, 6 deaths. And I personally wish to offer my sympathies to all the families and people who were close to the people who died. We have over 82 workers in the health network who have been touched and affected, 7 residents in long-term care, and many outbreaks in many caring healthcare centers, with a total of over 240 people. What is important to note is that, in fact, many Montreal territories, many central, are more affected by the problem. As of yesterday, we had 6 boroughs that counted over 50 cases. So Côte-Saint-Luc, Côte-des-Neiges, Notre-Dame de Grâce-Ndiji, Rosemont, Petite-Patrie, The Plateau, Ville-Marie, and La Salle. And now that we're looking at the progressions, there are neighborhoods that had more cases that are now having a greater number of cases and progression in the curve. Ahuntsic, Montreal Nord, Rivière-des-Prairies, Pointe-aux-Trembles, and Villeray. When we look at this data, what that tells us is that, yes, there are more cases in the central areas, but the spread and community transmission is sustained and is all over the island of Montreal. So the additional measures that we will be bringing forward are going to be applicable to all Montrealers. I also wish to say that in the course of the past few days, I said earlier that we had 146 cases in the course of the past 24 hours, which were declared. But in the past few days, we have seen a certain stability in terms of the numbers of new cases declared. The portrait that I'm giving you is a portrait that reflects what happened 7 days ago, because, of course, people who had symptoms had to go get their tests, and the time that it was declared to us, it represents the outbreak from 7 days ago. However, we will continue following the situation, but what we can see is not the number of new cases doubling every 3 to 4 days. Right now, we do have a certain stability that we will continue following, a certain progression, but the number of new cases per day seems to us to become stable in the past 3 or 4 days. So today, close to 40% of people who have been diagnosed are travelers, and of course, over 42% of people 50 years of age and over. Let's not neglect the 19 to 29 years of age, who represent close to 20% of the cases, often with symptoms that are a little lighter. Therefore, of course, we ask young people to respect the guidelines, since even with light symptoms, you can be important transmission vectors in the community. So as I was saying, the community transmission is implemented in Montreal. The numbers show it, and it affects the entire Montreal territory. So on Friday, the state of local emergency was declared, and the National Director for Public Health asked me to have a look at what the additional measures which should be put forward. As I said 2 days ago, we are not closing down the bridges. We are not going to put barricades in certain neighborhoods. The measures that we are putting in place must be gradual and progressive and must concord with the epidemiological situation. So the measures that we're adding are really with the objective of having the distancing measures be respected, to have the closure of public places and businesses that should have already been closed for the past week, to have that respected, and to give us leverage to have the orders of isolation of the people being investigated to make sure that they are compliant, or people in certain areas right now who are not respecting the isolation guidelines or of banning visitors. So what we are asking more specifically as additional measures to the SPVM is, first of all, to increase vigilance and surveillance in all neighborhoods through the police officers of the SPVM to allow us to have eyes on the premises. It's already been done for a few weeks, but now with more specific guidelines. And so if citizens or businesses do not respect the guidelines, now there will be an extra power, making a report for an infraction, and eventually a fine will be given to an individual or a moral entity or business. I will let Mr. Caron specify exactly how these offense reports may take place. Of course, the SPVM is also going to support us in the mission of individual orders emitted by the Director of Public Health for people who do not respect the isolation, as I was saying, or people who are being investigated, or people who live in certain areas without respecting those conditions. As I was saying it, when public health calls you because you are a case, you must collaborate with public health in the investigation. And if we do not have any return on a call that we have lodged to you, it is clear that we will be doing, that we will warn you once, but the second time you may have the SPVM visit you at home. The setup of these measures is also going to be allowing us to see to what extent the Montreal population respects basically the orders and the recommendations that have been made now for over a week by the National Director of Public Health. And it is by following the epidemiological situation in Montreal and also looking to what extent the population is compliant to the social distancing measures that we'll be able to see whether it is necessary to add additional measures that might restrict moving around more on public roads, so within Montreal neighborhoods, or even inter-urban movements toward other cities. But for the time being, we're not yet at that stage, and we will evaluate the situation from one day to the next. We are confident that with the intensification and this new leverage that we have, we will be able to fix the few exceptional cases that we can see on the Montreal territory. There are still people and groups not respecting the guidelines. And to end, I really wish to thank Montrealers because, generally speaking, Montrealers are respecting the guidelines. I think that the social norms have been well installed, and those measures are really for those who are recalcitrant. I believe that globally, we're all going down the right road about social distancing, and the better we respect these guidelines, less we'll have to restrain people. Our wish is certainly not to bring people to no longer be able to, for example, walk outside or jog. I think that we have to keep that zone of freedom in a difficult period such as the one that we are experiencing today. So I would like to remind you of a few guidelines. If you have symptoms that look like having a cold or the flu, headache, fever, we ask you to stay at home. If you have a hard time having a lab test, stay home for 14 days. Do not take any chances. For us, it already means that we are breaking the transmission. If you are awaiting screening result. If you've come back from traveling, you must also stay at home. So I now give the mic to the mayor. Did you wish to say a few words in English? Ah, yes. Sorry, I'd forgotten.
Words in English. Okay. Today I want to do an update of the Montreal situation and to announce additional measures that are going to be put in place with the collaboration of the SPVM in Montreal. So today we have more than 1,361 cases. It is 146 new cases since yesterday. We have 83 persons that are hospitalized, 13 in intensive care units, 6 deaths that we deplore, and 82 health workers that are affected by COVID-19. We have a large number of outbreaks in healthcare facilities that are for which we are taking in charge, and it's our priority because, of course, we want to keep our healthcare workers healthy and capable of working. As I said yesterday, we have some neighborhoods that are more affected than others, but we're seeing that the community transmission is quite spreading across the island. We have 6 neighborhoods with more than 50 cases. Donc, Côte-Saint-Luc, Côte-des-Neiges, Notre-Dame-de-Grâce, Rosemont-Petite-Patrie, Plateau-Mont-Royal, Ville-Marie et La Salle. And we see a progression in some neighborhoods that is more important: Annecy, Montréal-Nord, Rivière-des-Prairies, Pointe-aux-Trembles, et Villeray. Knowing that we have so many neighborhoods that are touched, the measures that we're putting in place are going to be in place for all Montrealers. All neighborhoods are going to be concerned, but of course, we're going to have more intensive interventions in some neighborhoods that are more affected. Still, we have most of our cases, but not most, 40% of our cases are associated with travelers, and 42% are cases among 50 years old and older, people older than 50 years old. But still, we have the group of age of 19 to 29 years old represent more than 20% of the cases. Sometimes they have less symptoms. So we ask them to collaborate and to make sure that they isolate themselves if they have symptoms, and of course they have to reduce the contacts and apply the measures linked to social distanciation. So yesterday, Friday, the emergency, l'état d'urgence for Montreal was announced. And the Directeur National de Santé Publique asked me to put more measures for Montreal. So what is going to be put in place? First, we ask the SPVM to increase surveillance in the neighborhoods, and of course, up to today, the surveillance was more recommendations that were given to businesses or people, but now we're going to have files that are going to be given if the businesses or the people do not respect the order. We're going to have also individual ordinance for people who refuse to isolate cases, people who refuse to isolate themselves, cases or people under investigation, or people in residency who have to conform to recommendations such as do not have visitors or do not or not go out of the residency. So we're going to be able to track and make sure that those persons do isolate themselves. Those measures, we're going to monitor them each day with the SPVM to see if the population is compliant. And with the epidemiological situation, we're going to see if we need to put more additional measures for Montreal. But at this time, we're not closing the bridges. We're not closing a neighborhood. We're putting in place really those first strategy, and the epidemiological situation does not does not make us think that we need to go further at this time. I just want to reinforce some recommendation and encourage Montrealers to continue to apply the distanciation sociale. First, if you are sick and you have any symptoms that are close to the flu, please stay home. If you have difficulty having a test or getting a test, the best thing to do is to stay home and to reduce your contacts for 14 days. The same thing if you're waiting for a result, you have to stay home. And if you're returning from a trip, you have to stay home for 14 days. And of course, I want to thank all Montrealers because I think the majority of us are applying the recommendation, and I think it's a collective effort to fight against COVID-19. Thank you very much.
Madame Plante.
Thank you very much, Madame Drouin, Dr. Drouin, and of course I want to salute Mr. Caron, who is the director of the Montreal Police Force, as well as Mr. Liebman, who's not very far, and who's the coordinator for the Coordination Center of Emergency Measures at the City of Montreal. So I believe that we can all say today that we have to vigilance is important because this is going to be a drawn-out fight. It's not a sprint. It's going to be a marathon, and we've already started it a few weeks ago. It is now time to get to a new stage, and it is, amongst others, for this reason that the City of Montreal has decreed the state of emergency on Friday, and that today we have, therefore, added 5 days to it, not only for the City of Montreal, but for the Montreal area agglomeration. So I wanted to mention it, and Dr. Drouin was mentioning it himself, to what extent Montrealers are showing solidarity. They are showing that they are listening, that they understand. I would say that the vast majority of the population is compliant, listens to the recommendations and applies them, and I really wish to thank them. But taking into account that the situation evolves from 1 hour to the next, I want to tell the population that we have a plan that is clear and that we are following step by step. And that's what we said previously, that, there is no question right now of closing down either a borough or a neighborhood or to close down the bridges. But we're following the plans very closely. The plan in the next few days really is to protect the community while minimizing the impact on individual freedoms. That's what it is. We're asking a lot from the population, and as I was saying, the vast majority is compliant, but we have to continue reinforcing that message with the population at large. There's a very small minority of recalcitrants who, for various reasons, are not following guidelines, and today the public authorities of course, will continue speaking and engaging in dialogue. But if necessary, the police will be able to get to the next stage. And I will let Mr. Caron talk to us about the different measures that will be applied. We also know that there are points, hotspots in the city, outbreaks that seem to be more specific to certain areas. So it's important to listen to the guidelines, to remain at home, remain in one's area. If you have any errands to run, do so in your neighborhood. Go one person at a time. Minimize any gathering from whether it be one kind or another. And when I say go to local stores, the good thing here is that it also encourages local shopping. And I would say that the stores that are open, who are working very hard, and I wish to salute all of them, all the people who work in essential services, especially for the supplies and food, the pharmacies. I thank them for their work. Thank you for being there. And to end with, I wish to mention that since Friday evening, when we decreed the state of emergency at 4 p.m., there have been different operations that started up to support the homeless population. That is one of the reasons, as I want to remind you, that motivated us to go further, because we felt that the needs were great and that the resources that were available to us were more limited. So first of all, there are 2 day centers that have been opened, one on Friday, the other Saturday morning. So the first is at Square Cabot, and the second one at Place Émilie Gaiman. And it's we're only starting because we have 2, but we wish to have a total of 5. But I really wish to salute our partners, the Resilience Center, where the Square Cabot is, who were the first to raise their hands saying, we need these resources. But I also wish to thank the Red Cross staff who, as of that evening and the next morning, were there on the premises to hand out food, amongst other things, to the homeless population. So many thanks to all those who are really joining in that fight, and I ask Montrealers to show solidarity and, of course, to listen to the rules as they do and have been doing so well for the past over 2 weeks now.
A few words in English.
English.
So I was saying that I feel like as we're moving forward in this crisis, it has to be seen as a marathon more than a sprint. So we need to be resilient. We need to follow all the rules and recommendation. And I do want to thank all Montrealers for doing so. I see how people are dedicated. They're listening to the different recommendation, and I want to thank them. Thank you so much. And we know that the situation is evolving, and it's always a pleasure to be here with Dr. Drouin so we can have a better understanding on the situation. And on Friday night, we decided to declare the state of emergency at the city of Montreal, and we decided to renew the state of emergency for an extra 5 days today during the city council, a special city council, and also for the entire agglomeration. With the state of emergency, I think what we're trying to say is, first, we want to be more agile in responding to some of the needs. And obviously, I'm talking here about the homeless community, but also in terms of making sure that everybody respects the recommendation. So ultimately, what we want to do is really to protect the community, protect the entire community while limiting the impact on individual freedoms. And to do so, we need the help of the different people around this table, of course, and it will be this way that we will go through this crisis. At the end, what I want to remind everybody is that there is a plan that we follow step by step. It is important to do so. We're not thinking about closing the city or to close neighborhoods. We will be following the orders of public health, and it is important to do it in a way that is respectful of our population, and to do it in a very coherent way. Finally, I want to say thank you to the Red Cross and the Centre Résilience, because on Friday, when we decided to move forward with the state of emergency, it was to protect. There was other reasons as well, but it was really to protect the homeless population. And so different people raised their hands to support us. And on Friday night, there was already an open centre de jour, a day center, and there was another one settled at Berry-UQAM on Saturday morning. So thank you for all the people supporting this initiative, helping us to protect the most vulnerable in our society. And final words to all Montrealers: keep the spirit, keep on doing what is expected from us so we can go through this as quick as possible. Thank you.
Nous allons terminer avec Monsieur Sylvain Caron.
And we'll finish with Mr. Sylvain Caron, the director of the Montreal Police. So hello, everyone. Thank you. The SPVM, since the beginning of the first decree, has been participating with the different authorities, whether it be civil or public safety and public health. So you know that we've made modifications to our working schedules to adapt ourselves to the needs of the situation. So I wish to thank the Montreal population and the Montreal urban area, which generally speaking really respects the orders that have been sent through the different decrees of public health. So today I announced that the SPVM PVM, of course, is ready and is collaborating with public health and civil safety. Mr. Lehman, hello. So each scenario is being studied in order to be able to respond to the needs of public health in this pandemic. So we know exactly what to do, how to respond, for the measures to take in function of the request of public health, depending on the analyses that they make. So we have staff almost doubled every day to make sure that the measures are respected. We also have specialized teams who have been brought to support area police forces for calls. So, of course, I would encourage the population to denounce unusual situations that happen in their neighborhoods. Of course, there are in places families where it's a numerous family that is together. But if it's an abnormal situation, please call us at 911 so we can intervene. So we have police officers who are going to be answering calls specifically in the case of not respect or a perception of a lack of respect of the government decrees. So we want for the population to continue with those calls. Of course, we also have teams that are intervening with vulnerable populations, such as the homeless. So we have set up different sites, collaborated to the setup of different sites since the decree of the emergency situation on Friday, and our teams continue working together with other teams. And of course, we have created awareness in our staff to all signs of vulnerability, whether it be women, whether it be children, to be more vigilant. And we are in contact with the different organizations to ensure that the people who are experiencing isolation are not victims of violence. So we have created awareness in our staff, and we collaborate with the different organizations in the territory to make sure that people are safe. All citizen calls are being answered by our police officers. It varies from one day to the next. There can be 100 calls, 200 calls. So we are present. I wish to thank the police staff, the 911 staff, the operational support staff. They've been doing excellent work since the beginning of this pandemic, as well as people from health. They collaborate a lot. So altogether, I think that we have a team challenge together to face this pandemic. The measure that we are announcing today, of course, the police intervene about calls. They will warn the people about respect or non-respect. What we wish since the beginning, of course, is to have collaboration. In the case where there is no collaboration, the police officers may write up an offense report, a shortened one, with the circumstances of the event so that the director of penal and criminal can emit infractions depending on this document. So that is a measure that we're taking today. What we're asking, of course, as Dr. Drouin said earlier on, is that we wish for people to collaborate as they've been doing since the beginning. But of course, the next stage, if there's a non-collaboration, there will be a bridge reports that will be given. So of course, we are counting on the citizens' collaboration to be able to continue. Thank you. For the question period, we will be starting with the only journalist who is present, and then we'll start I'll continue with the questions sent by email. We apologize to the journalists who were on the phone. We had to cut that off because of too much sound feedback.
Dr. Drouin,
Dr. Drouin, you are saying we knew which were the hotspots in Montreal, Amsterdam, Côte-Saint-Luc, Centre-Ouest. Now you're saying that it's extending to the entire territory. Is that what you're saying? Well, I had said so last week, that it had already started to spread for the past few days, but we are in a case of community transmission in Montreal. So clearly, we already had cases in other neighborhoods, including the Plateau, Rosemont, etc. But now we are following the progression in each neighborhood. Of course, certain neighborhoods, we can see the progression, but sometimes it's outbreaks that is linked, for example, to a CHSLD. So now we will slowly be able to differentiate what belongs to areas of healthcare, and they're very affected right now, whether it be CHSLDs or certain hospitals, so where we have workers and people who are housed there who are affected. This I call small outbreaks that we're working on within the place. with the teams that control infection. We have also the entire aspect of community transmission. So yes, we can see that there are more cases and that there is a progression in certain neighborhoods. And of course, there are the hotspots that continue having a progression. So I understand the police officers are changing attitude as of today. Well, the attitude remains the same. The approach that we wish is to have the collaboration of the people where we're called. But of course, if collaboration does not follow, there will, of course, be an offense report. Thank you. A few questions were sent to me.
Question d'Hugo Giguère de la presse canadienne. Dr. Drouin,
universities received a guideline, it would seem, to empty the residences of students. Was public health consulted, and is that a good idea in the middle of a pandemic? And yes, we participated. We had a few cases in residences, and clearly the issue in those residences was a lot of emitting measures of social distancing for the people who live there. It's been a certain time that the guideline was given, that the fact that the university was closed for a certain time, those who were in residence go back to their families, so that was done last week. And right now, there were temporary measures that would be emitted for foreign students, for example, who cannot go back to their families. So that really is each university that is studying the measures to be set up. But already asking people to go back in their families allowed us to reduce the number of people in those residences for whom it was very difficult. It was very difficult to have social distancing measures with a lot of common areas.
Question maintenant de Elsa Iskander du journal 24 heures, encore une fois pour Dr. Drouin. Avez-vous des statistiques?
Dr. Drouin, do you have any statistics on the number of homeless people that are affected by COVID-19 on the Montreal territory? Last night, I don't have today's numbers, but last night we had, I believe, 3 cases. But of course, we have a lot of people, homeless people who have symptoms and are being tested every day. The challenge right now, and I think that we're working very hard on that together with public safety and the CIUS, is to make sure that these people who have symptoms and tested be isolated during the period while they're waiting for their results. And if the result is positive, then they will be directed to the Royal Vic for a 14-day period at the least.
Les policiers sont-ils dotés de matériel?
Do police officers have protective material in case they have to intervene with citizens that are possibly infected? And have there been cases of infected police officers? In the first case, yes, we had staff that was trained. The frontline workers have the protective measures. Up to date, we have 6 people, police officers, who have tested positive. So the first 5 cases is more from a personal point of view, but the 6th one I can't tell you.
D'accord. La question de Sabrina Rivet du 98.5 FM. Est-ce que, toujours pour M. Caron, est-ce qu'il y aura des rapports?
Will there be reports and tickets that will be emitted? Well, today's objective is that if there is no collaboration with the people, there will be offense reports that will be drafted. First question for Dr. Drouin. Do we have any specific numbers on the breakdown of cases, the age of the people who are ill, and a breakdown by neighborhood? Yes, and as of tomorrow, after the Premier's press conference, that information will be put on the website of the Regional Direction for Public Health, the page COVID-19, which will allow us to follow the progression per borough, per neighborhood, the new cases. It will always be the data from the evening before, but our wish is truly to be able to follow with you the evolution of the situation, the epidemiological situation. Of course, the interpretation we'll be doing on our own end to tell you what we recommend.
What
kind of behavior are you referring to when we're talking about recalcitrant behavior? Are there infected people who are not respecting the quarantine? Would that qualify as that definition of gathering? Listen, I think that in the case of people who are not respecting the guidelines emitted by public health, we're talking here about orders. We'll receive the information from public health and civilian security as well from the coordination center. And in certain cases, it's gatherings where people refuse to comply. They refuse to leave the gathering. That is where offense reports will be drafted.
Pour le chef du SPVM et la mairesse, avec cet appel
with this call to denounce people, don't you think that there will be false denunciations, that there will be situations where police officers have to first and foremost manage the anguish of certain families? For example, families that might go out for a walk under the guidelines, but people go out on their balcony and yell at them and take pictures of them. Well, I can answer for one part. We don't want people to denounce, but we are in an out of the ordinary context. But if there is a situation that is happening close to your home and that is abnormal, that there is a gathering of people, you're not used to seeing a gathering or a situation whatsoever. You hear, an important gathering with loud music. What we're asking people is to warn us. It's not a denunciation. It's in a specific context in which we are evolving right now. Madame Plante? Well, it goes along with what the police just explained. We don't want all of a sudden for citizens to become patrollers. That is not at all the intention. But if you see an abnormal situation, which according to you goes against the recommendations that have been put forward, you can communicate it. Of course, the Montreal police force will also have priorities. You'll understand that. Thank you, everyone. That's all that we had as far as questions. No questions in English? No, thank you.